You asked for a series on obesity, and here we are. And in the category of things that we need to talk about, to speak about when obesity is a disease, there is one thing that we need to address, and that is the failure rate of medical interventions. When I went to medical school, we were taught to address obesity using a sort of 360 whole life approach with patients, looking at their knowledge about food and exercise, their motivation to change their behavior, how to assess what stage they were in their motivation to change their behavior, their psychological relationship to food and exercise, and so on. Back then it was called patient education. Not the best of terms, I'll very freely admit. But it was basically trying to walk your patient through profound lifestyle changes. We even had a clinic where they could come and stay for a week to get classes and workshops and start good habits. And there is evidence that such an approach works. But the approaches that work in medicine, if you look a little bit more long term, if you do a follow-up for a year or two rather than a follow-up for 2 or 3 months, the typical success rate is about 20%. Dropout rates in such management programs and in the trials is about 80%. And up to 80% of the weight that was lost is typically regained within 5 years. Basically, if you bracket surgery and now GLP-1 agonists, if you take all the more traditional approaches to obesity in medicine, it doesn't work very well. And when the traditional approaches do not work very well, this is when you get grifters. This is when people start to sell you snake oil. And just think about it. From an economic standpoint, the more the merrier. If what you want to do is hustle people into buying whatever you want to sell them with the promise of losing weight, they're going to be good customers, right? They're going to keep trying one thing after another as approach after approach fails them. So when we speak about obesity in the case where obesity is a disease, one thing we absolutely need to stop doing is pretending that treatment is going to be easy. Telling people to just eat less, just exercise more, everything will be fine. People for whom this is going to work do exist. And besides, eating a healthy, balanced diet and moving our bodies is good for us. But people for whom this is going to fix their obesity, we have to realize that they are very much the exception and not the rule.